Good morning. I hereby call to order the meeting of the Human Service Committee. I want to thank you all for being here this morning, and I want to extend a warm welcome to each and every one of you for joining us at this informational session. Today's meeting aims to provide the committee with valuable insights into the Office of Developmental Programs' intention to implement performance-based contracting for specific services covered under the Consolidated Community Living and Person-Family Directed Support waivers. We're privileged to have with us the Deputy Secretary, Christian Ahrens, of ODP to enlighten us on this proposal and its implementation plans. Following her presentation, we will hear from our 4 participants representing providers offering residential and support coordination services throughout the Commonwealth of Pennsylvania. They will share their perspectives and efforts underway in preparation for the proposed implementation. With that, Chairman Heffley, would you like to offer some comments?
Yes, thank you, Chairman Kinsey, and welcome everybody to this informational hearing. It's an important meeting, and I look forward to hearing the details from the Department of Human Services and from the providers who will be directly impacted by these significant undertakings. While I support the efforts to improve the quality of services, we need to ensure that the process is transparent, the goals are achievable, and are implemented in a thoughtful and measured manner. We must be mindful of our struggling workforce and maintain enough qualified providers to meet the needs of our citizens. I would encourage the Department of Human Services to meet directly with members in person so that we can ask questions and provide our constituents with accurate information. I look forward to everybody's testimony today. Thank you.
Thank you, Mr. Chairman. I'm sure if you don't mind, take the attendance, please.
Chairman Kinsey,
Present.
Representative Benham, Representative Serrata,
Leave. She will be joining us a little bit later, but leave for now.
Representative Farrell-Otten,
Leave.
Representative Jarrell,
Leave.
Representative Green,
For now, leave, but she will be joining us later.
Representative Khan,
Yep.
Representative Kincaid, Representative Madsen,
Leave. Oh, he's virtual, I believe. Virtual.
Representative Mays,
Leave.
Representative Prokopiak,
Leave, but he will be joining us later.
Representative Wade Smithell,
Leave.
Representative Vingett,
Here virtually.
Representative Dan Williams, Chairman Heffley,
Here.
Representative Cabell,
Leave.
Representative Flick,
Here.
Representative Gregory,
Leave.
Representative Grim-Krupa,
Leave.
Representative Labs,
Leave.
Representative McKenzie,
Leave.
Representative Schlegel,
Leave.
Representative Struzzi, Representative Tomlinson,
Leave.
and Representative Craig Williams.
Leave.
All right.
Thank you very much for that, Shar. Our speakers for today will be organized into 2 panels. We kindly ask each participant to restrict their remarks to a 5-minute duration. After all the statements are concluded, a designated time will be allocated for questions from committee members before transitioning into the next panel. I'm going to ask those folks that are present, if you don't mind, please mute your cell phones. Same with those folks in the audience, please mute your cell phones. With that, I welcome today's first participant, Deputy Secretary Ms. Christian Ahrens, who is the Deputy Secretary of the Department of Human Services, Office of Developmental Programs. Thank you for being here with us this morning, Deputy Secretary.
There we go. All right. Good morning, Chairman Kinsey, Chairman Heffley, committee members, and staff. My name is Kristen Ahrens, and I have the privilege of serving as the Deputy Secretary for the Office of Developmental Programs. I appreciate this opportunity to talk with you today about our proposed changes to our, what we refer to as the intellectual disability and autism waivers for residential services. So ODP is pursuing systems change to improve the quality of services. last year we began, last April 2023, we began seeking pretty broad stakeholder engagement, which resulted in a concept paper that we published in 2023 for public comment. We intend to apply for a 1915 B4 waiver from the Centers for Medicare and Medicaid Services. This is in federal language referred to as a selective contracting waiver. Our intent is to apply to put residential services under a selective contracting arrangement in beginning January of 2025. And we would like to begin in January 2026 that same arrangement with supports coordination. The federal government refers to this as selective contracting. That's what it's referred to in the Social Security Act. We hereforward are actually referring to it as performance-based contracting. Today, I'll focus my comments on the residential service component, since that is pending January 1st of 2025. And that is what is out for public comment right now. We released on the 20th of April a series of documents, our draft application for that 1915 B4, some amendments to our existing consolidated and community living waivers regarding residential services that support that change, an implementation plan, which is really essentially the operational guide that goes with it, which I think is probably the most important document for stakeholders, because it really provides the level of detail in terms of timeframes and how we will operationalize performance-based contracting. And then the last piece that went with that is the actual performance standards and performance measures. So those documents were all released. They are available for public comment through June 4th. The selective contracting waiver, this 1915 B4, is, ODP does not currently use this in our IDA waivers. The authority that we would be provided from the federal government allows us to restrict the provider pool as long as we can assure access to the service and we can assure quality of that service. And that's what the B4 application actually outlines. I want to note that there have been a number of comparisons to other states in terms of other states using 1915 B4, and I will say I want to draw some very clear distinctions. First of all, Pennsylvania is only applying this to 2 of our 35 services that are in those waivers. So, well, I should say 4 residential services, because we have residential services and then supports coordination, but it is a select group of the services. Second, we are maintaining the administration of this. So ODP will continue to administer the services just the way we do now in partnership with our counties, our administrative entities through our county government. The other very clear distinction with how some other states have used this authority is not only will the state ODP continue to be the administering body, but we are also not moving this into a comprehensive risk-based managed care arrangement. That is not what is happening. We are using this very narrowly. So in terms of the basic structure of this is for residential services. So this is residential habilitation, which we think of as licensed community living homes, unlicensed community living homes, life-sharing arrangements, and supported living. Those are the sort of 4 service areas that will be pulled in to performance-based contracting. We have established a set of standards. Each of those standards has a set of performance metrics or measures that goes with it. And we will be evaluating providers based on those new standards. We will assign tiers based on how a provider falls in terms of performance related to that. These tiers will be made public. The providers, what tier they are assigned will be made public, which will support individuals and families in terms of informed choice of providers. The other thing that's really important about the design with this transition to performance-based contracting is we have put financial structures in place to support this, to support the capacity building, to support providers, to meet these performance standards, to support and incentivize providers to meet these performance standards. For the tiers are split into 4 different tiers. We will bring in, one of the things that's really essential in ODP is continuity of care. Like we have, for the individuals that receive residential services, this isn't just a service provider, right? It's their home. And so for us, making sure that there are no disruptions to individuals' lives in this change, one of the things that we have said is all providers who are enrolled in providing services on January 1st, 2025, that want to continue providing services on January 2025 will be brought in. That includes providers who are in provisional and even revoked licenses pending appeal. So we hope that we can support the provider base to achieve these standards and continually improve quality of services. So that's conditional, that will be the conditional tier. The primary tier is really where we believe most providers will fall. And in this tier, there's 16 different performance areas that providers will have to meet. In some cases, there really isn't a change for these primary providers in terms of the requirements and what they will need to perform. The top 2 tiers are select residential, and one of the sort of defining features of this tier is that we expect that providers in this tier provide a continuum of services. So they provide that licensed residential habilitation, which is the most intensive of the services. They provide a life sharing or a supported living service as well. And the idea here is that we have providers who are really supporting that sort of continuum of care within the alternatives in residential service so that individuals truly who need a 24/7 service have the opportunity to live in the least restrictive of those environments. So that's sort of the characteristic of Select. They also have some additional performance measures. Clinically enhanced is what it sounds like. That tier does have higher standards related to staff training and to the clinical composition of their teams. In terms of those financial structures I mentioned, those top 2 tiers, clinically enhanced and Select residential, will have opportunities for enhanced payment. And by enhanced payment, I mean Select residential will have a 5% enhanced rate on top of the fee schedule. Clinically enhanced would have an 8%. Now these are all proposed. This is all out for public comment right now. The other part of those financial support mechanisms that we've got built in here is some pay for performance. So primary providers will have opportunities to earn pay for performance related to any of the areas that we're offering pay for performance. Clinically enhanced and Select will have opportunities for some of those since they're already receiving some enhanced rates related to those performance standards. So what the objectives here, what we're trying to do, there's really multiple objectives, but ultimately this all goes back to the people that we support and trying to make sure we have a sustainable system that is providing a high quality service. So, you know, if you look at, you probably, hopefully everyone has heard, you know, ODP's vision and mission is everyday lives. That is accompanied by a stakeholder adopted document that has 14 recommendations, lots of strategies. That is really foundational to kind of how all of this was crafted. But the goals here, on top of just this broad goal of improving quality, we have to build a system that is sustainable. You've all heard about our workforce issues. You've all heard about the waiting list. We've got 13,000 people waiting for services, 4,500 adults who are in the emergency category waiting for services. We've got a 23% vacancy rate for our workforce. We do not have a sustainable system as it is right now. We don't have the clinical capacity that we need to meet the needs of people coming to us. We increasingly have people coming to us with more complex needs than they used to. This is borne out by data. When we look at statistics, you've got, you know, probably all heard the CDC stats, right? We've got 1 in 36 children is now, children age 8 have autism. They're on the autism spectrum. 25% of those children considered on the more severe end of that spectrum. They will be adults, right? They will be coming to us looking for support in the future. Our system is not prepared for that. We have 40% of the people coming to us right now have co-occurring mental illness and intellectual disability or autism. And our system is struggling often to meet the needs. So part of what we have to do with this proposal is build clinical capacity so that we can really offer individuals restorative therapeutic environments. We have to build a system so we do not have individuals boarding in inpatient, boarding in emergency rooms, sitting in jail beyond when they should be. One of the other, in terms of improving quality, residential services for ODP cost an average of $205,000 per person per year. And when we look at our data and trending related to things like incident management, health disparities, abuse, neglect, we know that there is room for improvement, and we are committed to doing that. The current system and our current arrangement with the federal government, we're fee-for-service, and we pay the same rate to a provider for that day of service, whether it was an absolutely excellent day of service that supported individual outcomes, or it was a poor quality day of service. We do not have any way to incentivize or pay providers to produce really quality services to help individuals achieve their outcomes and to support sort of system outcomes related to workforce, sustainability, cost effectiveness, et cetera. So a couple of the things that are built into this. When I talk about system sustainability, I mentioned that continuum of services. One of the things that we've got to drive at here for sustainability is cost effectiveness. We know that there are things that we can do to improve the cost effectiveness of our services. Those life-sharing services, supported living, are not only preferred by individuals in all of our quality of life and satisfaction surveys, they're also more cost-effective. They also rely less on traditional staffing. So when we look at our workforce issues and sustainability, the wherever we can kind of relieve some pressure from that traditional workforce, the better. Our workforce solutions have to be multifold. We have to address wages. We have to address retention, which is one of the things you'll see built into here is credentialing. We know that professionalizing our workforce, credentialing is one way in terms of research that you can see better staff retention. We also have to, wherever we can use technology, and that may replace a person, a direct support professional doing work so that we can use them elsewhere, the better. So the workforce strategy has to be multifold. And if you look through the full proposal, you will see we sort of hit on all of those things. Let's try to reduce reliance on traditional workforce as much as we can. Let's work at credentialing, professionalizing DSPs. Let's work on the wage issue through some of these payment mechanisms that we're doing. And let's use services that require less traditional staff. So I've got, in the document, you can see some examples. So we've got that continuum of services I mentioned. And we've got in that continuum, meaning residential habilitation licensed home versus life-sharing supported living. We've got payment incentives in there. We've also got enhanced payment. So there's both the way the tiers are structured, the way the payment is structured is all aiming at trying to get some movement in that direction. You've got credentialing in here. Again, this is one of those areas that we are very committed to professionalizing the workforce. Again, that helps with staff retention, and the payment structure and tier structure is designed to support all of that. I know you said I had 5 minutes, but I think it's fairly impossible to describe what we're doing in 5. Am I okay to keep going? Am I okay to keep going? Okay, sounds good. So let me take us to the value-based payment here. So the governor's proposed budget for 24-25 has $483 million in it for rate increases for ODP services. Of that, $50 million, that's state, federal combined, is requested funding to support performance-based contracting. So I think I've described, we've got a number of areas where there's pay for performance. That's that continuity of services or the continuum of services, workforce, individual employment, technology, and community inclusion. So we've got lots of opportunities in there for pay for performance. We also have those enhanced rates. So the value-based payment is sort of built into this, and there is funding in that $483 million that is specific for the implementation of performance-based contracting. We are very clear that we cannot raise the expectations and employ all of these new standards for providers without financially supporting that activity. So performance, I've mentioned the kind of financial support in terms of providers, supporting providers to meet these standards, understand what we're doing, and kind of support providers with this transition. We will be releasing very soon a provider preparedness toolkit, which has both a self-assessment, work plan, bunch of resources. We also have a number of forums that are scheduled in the implementation plan. We plan to continue those on a quarterly basis. So there's some good support in there for providers. One of the other things that's important is there really is sort of a phasing in of these requirements. Many of the new performance measures are actually current requirements. The providers that are in those top tiers, we're now giving an actual performance metric that they have to meet. So for incident management, it's been a requirement to report all incidents for as long as anyone can remember. We now have, for those top performing providers, there are actual number standards, percentages that they have to be meeting in order to qualify in that tier. So stakeholder engagement, I know you mentioned it in your opening, Chairman Heffley, and we have had we put all of this out for public comment, and then really the implementation plan and all of the specific performance standards and performance measures were designed by a stakeholder work group. So we had a work group. The details of who was on that are in the prepared testimony. That group met many days and hours, really hammering through the very specific performance metrics to design something that hit on sustainability, workforce, clinical capacity, access to services, community integration, all these things that are critical for us in terms of moving the system forward. Designed a package of those metrics together and with a very keen eye to, are these achievable, and making sure that we can still support small providers, that we don't create a system that is going to really disadvantage smaller providers. So I think that work group put together a very solid package, and that is what is out for public comment. So in conclusion, we have challenges in front of us in the IDA system that have to be addressed. And we have engaged stakeholders very intensively to try to do that. We're in public comment period now. And I think what we have put forward to do in 2025 and we'll do in 2026 with supports coordination is a very PA specific, a very Commonwealth specific way to try to tackle these issues and build a high quality system for the future. Thank you. I'm happy to take any questions.
Thank you very much, Deputy Secretary. And for folks who are in the audience, we gave the Deputy Secretary latitude simply because of the fact that she was explaining the program. For the other testifiers, again, we're going to ask you to limit yourselves to 5 minutes. And for the members who are here who have questions, we're going to ask members to be very direct with the questioning. I want to be respectful of the fact that many of us will be on the floor by 11 o'clock voting on important issues. So I want to make sure that we recognize the time. I also want to recognize Representative Ronnie Green, who has joined us. And with that, we're going to go directly into questioning. Representative Benham.
Thank you, Chair. Good morning.
Good morning.
Deputy Secretary, it's good to see you as always. So obviously the goal here is to improve quality, but it sounds like this could potentially reduce the number of providers in the system. Is there any concern about that, about the reduction of system capacity? And if so, is there a plan to ensure that we don't see an increase in the waiting list?
Very good question. Thank you. So we actually don't anticipate this reducing the number of providers very much. I mean, I think providers who are currently in conditional or provisional status are struggling anyway. That is a pretty small percentage of providers. But the idea here really is to lift all boats. We have some really great providers in our system, and struggling with, workforce issues and a whole set of pretty complex regulations and policies that they're operating under. One of the things that we would like to be able to do, and we think we can do with this, is streamline some of that. If we can see that providers are performing at these higher levels, we would like to reduce some of the regulatory oversight and burden that they have from the other processes we currently use that are all very compliance-based. So that's, I think that will help providers. In the event, one of the assurances we have to give to the feds is we will be continually having to review access. So we've got standards for how we will do that. And if we have any issues related to access, if we're not hitting timeframes for providers taking people who are referred for residential services, if we can't hit timeframes and we don't have adequate number of providers, our assurance to the federal government is that we will bring additional providers in or expand current providers. So we are fully prepared that if we start seeing those trends, that we would put out an RFA and bring some additional providers in.
Thank you.
Thank you. I also want to acknowledge Representative Grimm-Kruper as well as Representative Serrato who have joined us as well. Representative Struzzi, you have a question.
Yeah, thank you, Mr. Chairman. Good morning. Rep Benham took some of what I wanted to ask related to the providers, and I don't understand, though, how adding additional administrative requirements is going to help address the backlog on the waiting list. And I do appreciate, the comments that you said about, hopefully streamlining some services or, using more automation perhaps. But I have some concerns, again, that the timeline's relatively short here coming into January to start this, and you're still looking for public comment. Where can people find that document?
They were all published in the Pennsylvania Bulletin. They're also up on the DHS website, and we can certainly make them available to the committee.
And can you explain a little bit more in detail then how the $50 million budget request will be utilized?
For the two top tiers, the clinically enhanced and the select providers, on top of their fee schedule rates for residential services, the select residential providers will receive an enhanced payment of 5% on top of that, and the clinically enhanced will receive an 8% on top of that. And that's to support the fact that we are expecting higher ratios of clinical team members, clinical staff. They have additional training requirements, additional standards related to the employment rate for individuals they serve. So that's really to support all of that additional expectation.
Okay.
And pay for performance. So we have 5 different areas that providers in 3 of those categories, primary, select, clinically enhanced, will all have opportunities to earn pay for performance related to 5 different areas.
And when you're, try to be brief here, but when we're looking at this from a statewide perspective, I have a rural Indiana county, and the provider pool, and you use the term restrict provider pool, and that does concern me. So are you looking at this from a statewide perspective as in, geographically where these different tiers are going to be located and how those services will be provided to make sure that there are no gaps across the Commonwealth?
So I think the way to think of what we're doing here is we are going to restrict the provider pool to providers that provide high quality services. So right now it is every willing and qualified provider. That is the current arrangement with the federal government for residential services. So we will be restricting it to providers who can meet those quality standards. We will bring all providers in and have really, between the financial tools and then all of the preparedness activity that we've got and sort of phasing in these requirements, we think that we can support providers to meet these standards. and hopefully expand their service offerings. We have a number of providers out there, I think particularly because of the pandemic, they were really battered. They're still operating on some pretty high vacancy rates. We have providers who I think would be eager to take referrals, but they're struggling to get the workforce.
Well, thank you. I would just ask that you keep us informed and make sure that we don't have situations like that occur as this continues to roll out. Thank you. Mr. Chairman.
And the federal government will require, that is one of the standards for the federal requirements. We will have to do constant surveillance of access to residential services.
Thank you, Representative Struzzi. Representative Dan Williams, and again, I just want to remind members, because of our time limitations, if we can just ask one question, have the Deputy Secretary respond to that one question as quickly as possible, so that way we can try to get as many questions answered by the members, as well as bring up our second panel. So just keep that in mind, and if we do not have an opportunity to go to a second question that many of you might have, we can submit those to the Deputy Secretary and get a written response. Thank you. Representative Dan Williams.
Chair Kinsey, thank you. Madam Secretary, thank you for your testimony as well. I'm going to truncate my question then and just ask, I recognize the complexity of the problem, the desire to improve. My question is, how will this proposal, it could be here, perhaps I haven't read it, how does it ensure the proper feedback from families and individuals who are receiving the services?
So the stakeholder engagement that we've done to date has very much involved family and individuals with disabilities in terms of gathering feedback on this. In terms of going forward, one of the measures, I'm glad you asked this, because one of the measures that we're actually going to be using is related to family engagement. So that is something that we will be measuring as part of this, which I think will give us a lot of very good information. A couple of the other measures are essentially beneficiary participant experience. So we have already cooked into these new performance standards a couple of ways of really trying to look at that.
Appreciate that. Thank you, Chair.
Thank you very much, Representative Williams. Representative Flick. Oh, you're good? Great. Thank you. Thank you very much for that one. Chairman Heffley.
Thank you for your testimony today. I just would ask in the future, I mean, we received your testimony this morning, and trying to prep for meetings like this when we are on a time constraint, it would be really helpful. I know it has to go through a lot of layers, but that it would be a little bit more consideration in trying to get that testimony out a little bit quicker. I guess as we go through this process, I've heard from some of the providers, but how can we really ensure that there's going to be transparency and fairness? I've heard stories sometimes when people come out to do on-site visits, you get the rumor of the white glove looking for a little bit of dust here or there. And it seems like this could be open to really kind of targeting certain providers, maybe for whatever reason. How can we ensure that that doesn't happen, that the providers have recourse if they're not going to be receiving some of these benefits, and that there's not going to be any abuses in the system?
So a couple of things. The performance standards and measures themselves will have an accompanying sort of data dictionary that says exactly what we're looking at, what the data sources are, how we're measuring it and evaluating it. So that will be a public document. Once we finalize the measures, then we will publish that. So how we're doing it, if anybody's familiar with the healthcare system and the HEDIS measures, the healthcare effectiveness data information set, they publish exactly what they're looking at. So we will have a document like that so people know what those data points are. The other thing is we have established through our advisory committee a quarterly forum where we are sharing out publicly this data, because I think it's important. We're all talking about, we want to understand in our system what kind of restraint use do we have? How many restrictive procedures? Are we seeing improvement in these areas? Are we improving our performance related to inpatient hospitalizations and crisis intervention? So part of our commitment is we're going to start having that conversation on a quarterly basis with all of our stakeholders, sharing out all of that data publicly. So we already had the first of those meetings. We did share publicly the provider data in that session. So I think part of it is all this publication and sharing of the documentation. Other thing, very importantly, providers, there are appeal rights for this. So if a provider feels that their tier assignment was not proper, they have appeal rights and they can appeal that decision.
I think that's a concern that I have. I mean, even if you do appeal it, then I just don't want to be targeting providers for whatever reason, and make sure there's fairness in that system. That's the only one of my concerns that should be really addressed going forward. Thank you.
Any other members have questions? Deputy Secretary, just very quickly, if a license is currently revoked, what are some of the standards or the basis for revoking a license?
A license is revoked for either very serious incidents that weren't remedied or sort of a history of citations that weren't remedied. So typically, if licensing goes out, they'll write up citations. Provider has an opportunity to correct those. The most common thing we see is a provider didn't implement the plan of correction, and that's what then lands them on a provisional license. So if that continues, serious incidents happen, that's, at some point that becomes a revoked license.
So if a license is revoked, does that mean that the providers still have the privilege to operate or not operate?
Pending appeal. So if a provider appeals, they can continue to operate until that appeal is heard.
Typically, how long does an appeal take?
It varies, but it tends to be a long time.
Okay, so under the new proposal, we're saying that if a provider's license is revoked, they can still operate under this new program. Is that correct?
For implementation, as we are implementing it now, yes. For continuity of care purposes, we are bringing all providers in. That all providers that want to, that sign a contract with us for January 1, they will all come in, even if they are on that status.
So the department has a contingency plan in the event that the appeal process does not work in favor of the provider. And again, they're part of this new rollout. So there's a contingency plan to ensure that those individuals who are receiving services under a program whose license was revoked and the appeal was lost. Is that
Yes, and this happens currently in our current system. We will have a provider that is under a revoked license that we have done everything from emergency removals to we have a date they will no longer be operating, and so we transition those individuals out. So we would use that same process that we use currently if that does occur.
Great. Thank you very much. We've been joined by Representative Otten. Just want to thank Representative Otten for joining us. And Deputy Secretary, we want to thank you for your testimony. It was a lot of great information, and as we saw, quite a few questions that the members have. And for the members who still have additional questions, we'll ask that you submit them to the EDs in writing, and we'll get them to the Deputy Secretary. Thank you very much for your testimony this morning.
Appreciate the opportunity. Thank you all.
We're going to continue on and move right into our second panel, and I'm going to call up Ms. Judy Dotzman, Chief Executive Officer of SPIN. Ms. Linda Washington Brown, Chief Service Officer for Developmental Services at Horizon House. Mr. Charles Barber, Chief Executive Officer of the Erie County Care Management. And Mr. G.N. Janes, Chief Executive Director of Valley Community Services. Mr. James, sorry, you're the last one, so you don't get a roll-up chair. All right, you gotta slide your chair up. No wheels. But we want to thank each of you for being here this morning. We're going to start to my left with Mr. G.N. James, and we're going to ask each of you again if you can limit your testimony to just 5 minutes. I know that there'll probably be a robust of questions that are coming from the members, but again, I know the members have to be on the floor to vote by 11 o'clock. So again, thank you for being here, and we'll start with you, Mr. James.
Thank you, Chairman. Good morning, Chairman Kinsey, Chairman Heffley, and members of the Human Services Committee. Thank you for listening to my testimony. My name is G.N. Janes, and I'm the Chief Executive Officer of Valley Community Services, a mid-sized nonprofit that provides supports to Pennsylvanians with intellectual disabilities and autism across 11 counties. Our program ranges in intensity from minimal supports to people living independently to intensive systems for people who have complex medical or behavioral needs. We employ close to 500 people across the Commonwealth. For years, our organization has struggled to maintain a full complement of experienced staff because reimbursement rates did not adequately compensate for the staffing and administrative supports that our system requires. The pandemic furthered that struggle to a critical level that my organization has yet to recover from. I applaud the proposed investment in reimbursement rates and regulatory oversight, as they are important first steps to our system's long-term sustainability. Valley Community Services welcomes a time when we will be evaluated on positive outcomes for the people we support, rather than via the lowest common denominator of licensing inspections. Performance-based contracting could be the bridge to a system that puts people before units. Pennsylvania is at the vanguard of a system that can place the person served at the forefront. Decision makers at the Department of Human Services and Office of Developmental Programs can and should be lauded for their commitment to a sustainable system that addresses long-standing shortcomings that states across the country are struggling with. My caveat is that we must take great care to foster a set of quality measures that make sense for Pennsylvanians supported by our intellectual disabilities and autism system, and one that ensures a vibrant provider community that has a hand in implementing them. Quality measures must be backed by empirical data points that demonstrate positive, inclusive outcomes that residential providers understand and can implement with their finite resources. The proposed ODP budget takes a welcome first step in addressing decades of underfunding. Providers have historically spent most of their capital investing in wages of their direct support professionals, the backbone of our system. As such, providers, especially smaller organizations, have very little cash on hand to invest in the infrastructure necessary to be successful in performance-based contracting. Similarly, this system that has been underfunded and in need of cash investments lacks the luxury of investing these finite resources into policy shifts without the full picture of its implementation and operation. I would warn our state partners that an unintended consequence of overly rapid and ambitious system reform could result in provider deserts, where rural communities lack the same variety of choice and quality that larger areas enjoy. One only needs to look toward the physical health space, where consolidation has resulted in disparate health systems and health outcomes based on proximity to large urban areas. We must learn from these disparities and seek not to repeat them in our own space. I come here to praise the Office of Developmental Programs, not bury it. The staff are proposing a revolutionary means with which to reward organizations who adhere to everyday lives principles that are the foundation of our system. They deserve the national plaudits and attention they are already receiving. However, being the first state to implement such a system such as this across a community as large as ours, requires intentional, cautious movements forward, lest the law of unintended consequences creates a system where less Pennsylvanians and not more are supported. Thank you.
Thank you for your testimony. And you're able to stay once the panel's finished to ask questions?
Yes, Chairman.
Great, thank you. Mr. Barber.
Good morning, Chairman Kinsey and Republican Chairman Heffley and all the honorable representatives here today. My name is Charles Barber. I'm the CEO of Erie County Care Management. We are a supports coordinating organization in the ID system. We also provide care management in the health choices. We do administrative case management. We do service coordination and early intervention. We perform the coordinated entry in homelessness, permanent supportive housing, street outreach. We partner with UPMC in the community health choices. And we also do a lot of other things that the county would require of us or ask of us. We presently serve a little over 5,000 individuals in our supports coordinating organization in 10 counties. We are not only in Erie County and Crawford County in the Northwest, but we're in Carbon, Monroe, Pike, Luzerne, Wyoming, Schuylkill, Lebanon, Lancaster, Dauphin, and are moving into Northampton counties. So I am in favor of selective contracting or performance-based contracting. I believe that this new way of looking at things will only serve to increase quality for our consumers. I grew up in the human service system. My family began a ID autism provider in 1956. And so I've spent my entire life dealing in this area, and I will tell you that anything to improve quality is very essential and very important. You know, a lot of people get very nervous when you're asked to take an inner look at yourself and an inner look at your organization. And I think that actually is a hard objective to do, but it's an extremely important objective. And really what selective contracting and performance contracting is doing is making all of us take a good hard look at what we're doing and how well we're actually doing it. And what the most important thing is, how are we taking care of our consumers, who are the most needy individuals and fragile individuals in our communities. So in order for us to prepare for selective contracting, and I get the privilege of going a year after the residential providers, we are looking deep into the organization. We are going after our NCQA accreditation. We're going after our National Association of Dual Diagnose accreditation. We have tied in with the University of Missouri in order to get all of our supervisors to get ambassador accreditation in everyday lives. We are looking deeply into how we do our internal training. We're looking at how we disseminate our expertise information in foster care, in forensic, in employment, in ADS, in mental health, in all the different areas that really need to be integrated inside the ID system. Obviously, this has a cost to it, but ODP has begun to address those issues in their latest rate increase that'll begin here in July. I'm not sure exactly how performance contracting rates will be designed. I do sit on the Strategic Thinkers Group for the SCOs. I have seen the standards and the measures of the standards up until this point that we have been able to cover, and I will say that they're very reasonable, and that there's something that not only reasonable, but they're achievable. And I think they're achievable within the time frame. And I also believe that we have yet to sit down and discuss the new payment plan, but from what I've seen in the past and working with different SCOs on that meeting team, that Strategic Thinkers team, I believe we'll come up with a reasonable method of which performance and quality will be measured and reimbursed. Thank you.
Thank you for your testimony. We're going to move right along. Ms. Linda Washington Brown.
Good morning.
Good morning.
I am Linda Washington Brown, Chief Service Officer at Horizon House. I just want to extend my gratitude to the co-chairs of the PA House of Human Services Committee, Representative Kinsey and Heffley, for the opportunity to share insights today on performance-based contracting issued by the Office of Developmental Programs. As a stakeholder providing services at Horizon House, I am also grateful to serve on ODP's Strategic Thinking Work Group with a diverse and balanced representation of the provider community and other stakeholders to offer input to the framework of performance-based contracting. I'm appreciative of the offer to offer my perspective and recommendations of the information that's been provided thus far. In Pennsylvania, intellectual and developmental disabilities and autism services are at a critical juncture. IDA services are in crises. The staffing workforce crisis has left us struggling to provide quality care with minimum staff. Financially, the current fee-for-service model is unsustainable. In response to the challenge of how to sustain home and community-based services in the Commonwealth, the Department, the Office of Developmental Programs, is implementing performance-based contracting in support of system reform. Our organization, Horizon House, is committed to helping individuals we serve to live fulfilling lives in the community of their choice. Over the years, Horizon House has responded to the needs of individuals by broadening scope of programs and services for adults with behavioral health needs, individuals with intellectual and developmental disabilities, as well as homelessness. Our goal is for everyone we serve to have the opportunity for growth, community, and a better quality of life. Today, our organization serves roughly 5,000 individuals annually in the state of Pennsylvania and Delaware. We provide behavioral health services in Pennsylvania and in the state of Delaware. In Pennsylvania, our services expand in Bucks County, Delaware, Montgomery, Lehigh, Northampton, and Philadelphia. Specific to our IDD services, we are predominantly in the southeast region of Pennsylvania, in Bucks, Delaware, Montgomery, and Philadelphia counties. We serve roughly 150 individuals, and our core business is residential services, life sharing, employment services, behavioral health services, and in-home and community supports. It's my understanding, and based on our organizational experience at Horizon House from our behavioral health entity, alternative payment models such as performance-based contracting is a much more sustainable payment model if the rates are calculated properly. I offer these reasons. The model of payment incentivizes quality over quantity, predictable revenue targets with cash flow, greater flexibility in operating along with potential for cost savings that could be used to enhance mission-related services. There's also opportunity for risk and reward. In review of the 16 performance areas along with the 31 measures, ODP is to be commended for the inclusion of the following: support addressing the workforce crises, including addressing wages of direct support professionals, inclusion of credentialing in support of professionalization of our workforce, which has been shown to improve job satisfaction, implementation of more outcomes-based payment, enhanced participation and experience and satisfaction from those that we serve, and the focus on education as a means to achieve quality outcomes. There's also the recommendation for the incorporation of evidence-based practices and customized interventions. While the proposed model is reasonable from a quality standpoint, there is evidence that it's a very aggressive implementation for an industry in survival mode. It appears that some of the timeframes are conflicting and overlapping at times. Furthermore, current personnel vacancy rates in our system remain high for the industry despite significant effort on the part of residential providers focused on recruitment and retention strategies. Although the performance standards and measures align with strategic goals around population health, the number of standards could be overwhelming from a resource and financial perspective. The end result could be unintended reductions in the number of residential providers and/or increases in mergers and acquisitions. Investment in technology and infrastructure could also be viewed as impediments to providers as resources to purchase or upgrade technology in support of incorporating technology into the areas of data management and remote service delivery. Depending on the size of a provider organization, the investment needed could be quite sizable. I would ask ODP to consider the impact of the aforementioned concerns to the long-term goal of stability. As a provider, Horizon House strives to deliver the highest quality of person-centered supports and services. Our goal is to achieve the preferred tiered rating. The effort to achieve this status may come with new requirements, but review this as an opportunity. Over the past year, our executive and senior leadership team has been focused on changing the way we work with focus areas that include embracing our work culture, improving operational efficiencies, and creating and responding to opportunities such as this. We've developed goals and action plans that include wellness, engaging a high-quality and high-performing workforce, learning and development for our staff, and, of course, the emphasis on quality. We're striving to achieve excellence in all services across our day-to-day operations. We continue to be committed to focusing on improving the core purpose of home and community-based services, supporting people to have a full and productive life in the communities in which they live. In closing, I'd like to thank the chairman and the members of this committee. I would also like to thank the governor for his proposed investment in our system and urge the General Assembly to pass it in full. Regardless of where things stand with performance-based contracting at the time of the budget passing, we do know, no matter what, that every penny of the $217 million state investment plus its federal match, we will need to implement this next level initiative. Thank you very much.
Thank you very much for that as well. And we're going to conclude with Ms. Dosman. Spin. Welcome.
Good morning. Thank you, Chairman Kinsey, Chairman Hoffley, and members of the Human Services Committee. I am Judy Dotsman, President and CEO of SPIN, a provider of lifespan services for people with intellectual disability and autism in Philadelphia, Bucks, Montgomery, Northampton, and Lehigh counties. I thank you for the opportunity to provide our experience and viewpoint regarding what is needed to prepare for performance-based contracting. First and foremost, we believe the change and a redesign of the system is necessary, and conceptually, we are aligned that a model driven by quality standards is a good one. We appreciate Deputy Secretary Kristen Aaron's leadership on working to build a more sustainable system. I also support the department's efforts through performance-based contracting to enhance rates for higher quality providers who meet the specified criteria. In order to accomplish this, providers need additional information on the criteria and the resources available to help them. To turn a huge system, 50,000 plus people surrounded in their families, supported in their families, providers need concrete details to be prepared to meet the next level quality standards. To give you some industry context, let me just take 30 seconds to describe the adverse financial conditions we've endured. I believe this will help you all understand why specific detail is critical while also providing you some perspective of why we are so grateful for the governor's proposed investment of $217 million to intellectual disability and autism services. Providers have been struggling to keep our services running. We are experiencing a workforce crisis, as my colleagues have said, and huge deficits. Other businesses use the pandemic to describe a before and after story, but the intellectual disability and autism industry has been experiencing this adversity and deficit for well over a decade. We've been hanging on a thread before the pandemic, and the pandemic took a scissor and cut the thread. SPIN is currently experiencing over $1.5 million deficit, and we have a shortage of almost 100 direct support professionals to fill vacancies and to expand our needed services to provide support to those on the waiting list. We have been provided a framework with limited detail regarding the performance-based contracting process,
and the elements included in the process. There's no doubt that significant resources will be required to reach high-quality standards. Providers need to make investment in the areas to meet quality indicators. However, our services have had a lack of funding investment over significant years, and providers have been left on their own to make these investments. SPIN has been investing in quality indicators on its own for years, including our recruitment, professional development, career planning, and retention strategies, just to name a few. We've been a member of the National Alliance for Direct Support Professionals, NADSP, and actively engaged in their eBadge credentialing program, as well as the National Association for the Dually Diagnosed. We are accredited. We see a return on our efforts and investment by increased recruitment and retention and highly qualified workforce outcomes. Our culture and work has placed us as the top workplace for 15 consecutive years. In addition, we've invested heavily in our business analytics, data management systems, in order to be able to collect and report data. All of these will be requirements of performance-based contracting. There is an expectation and a trust that providers will invest and front-load these costs to be able to achieve the highest levels of quality. We need concrete details regarding the quality standards of the process. We need to assure that this process reduces redundancy and oversight instead of adding administrative burden to an already overcomplicated, highly monitored system. It is critical that the department be receptive and willing to make adjustments based upon the feedback provided from providers and other stakeholders. We need an infusion of multi-year funding investment to be able to achieve qualitative system reform. People with disability need fully competent, highly qualified, direct support professionals that are paid a living wage to support people to live their best life in the community and for their families to have relief from the stressors of lifelong caregiving and the haunting worry of what will happen to their loved one after they are no longer here. The critical shortage of qualified direct support professionals puts people with intellectual disability and autism and their families at great risk for harm. Governor Shapiro sees the need for investment in our services. His budget proposal will begin to address the financial resources necessary to pay for the ramp-up investment to achieve high-quality standards. We need this funding for IDA services to be an accepted piece of the budget, protected and not touched. Quality has been and continues to be a hallmark of SPIN and its services. We need to assure a successful transition to a new model or system that does not cause disruption for the people we support, their families, and the people and resources providing the support. We need to assure that providers are fully prepared, being in the know, partnering hand in hand to achieve these quality standards. Thank you so much for this opportunity.
Wow, thank you. I want to thank each of you for your testimony this morning. We're going to go directly into questions. Representative Benham.
Thank you, Chair. I appreciate each of your testimonies this morning, and any of you can answer this as you feel called to do so. So it seems at times providers are understandably more curious about or potentially worried about the impact of some of these changes. And I'm wondering if there are ways you feel like ODP could better communicate with you or work together with you as they move forward in this process.
Thank you, Representative Benham. We feel, and I think that Jen and Linda have shared as well as I, that there has been a great deal of involvement, with providers to begin to develop this system reform. We had representatives on as Linda shared, on the residential strategic thinking group, and that was extremely important. Where we're at now, I would believe, is that we need to now connect the dots. So the how, and we know the why. We have the framework. We now need to start to be able to get to how do we get to these to assure that we are going to meet the standards. I believe strongly, as Linda shared, that we want to be at the highest levels of these performance standards as far as the tiers are concerned. So we need to be able to have the information so that we can begin to not just prepare but plan for that, because the resources that will go into it are pretty enormous, and so we need as much time and an opportunity to be able to ramp that and be able to be prepared. So it's more information, and it's not that it's not. I think that there's things on the horizon, as Deputy Secretary spoke about. So we need these to come as soon as possible so that we can begin to plan. I don't know how else.
To me, it's not just going into the implementation, but it's the continuing communication and sharing of information and data after the implementation so that things can be tweaked, things can be made better as you go forward. Everything's not going to be 100% on day one. We all know that. But it should be a continuous improvement program. For SCOs, we're moving into the new software, ECM. It's my understanding that probably has been extended for 2 years on that being rolled out. So what the data is going to be, how the information is going to flow, I'm not completely sure, but I believe that that's going to be a key to the implementation of this, is actually what takes place after the implementation.
Great.
I'd just like to add, in response to the question, and I agree with Judy that we need a little bit more detail, and I think for us, the emphasis has been on the timeliness of the information being disseminated. I fully support this reform and what is being proposed by Deputy Secretary and her team, but I also would ask that just as we have a new expectation as providers, that Deputy Secretary and her team would also consider that perhaps there's a new expectation as to how the information is conveyed, how timely that is, and more frequently, the frequency of it. And I think that would be very helpful to all of us.
Great.
Thank you.
Thank you. Representative Struzzi.
Yes, thank you, Mr. Chairman. And I do want to thank the Deputy Secretary for staying to hear your testimony. The timeline, do you feel that is reasonable to start the implementation of these requirements in January of 2025? Is that possible?
I would say I'm not sure, right? Once the information is completely rolled out, and let me echo, I was a part of the Residential Strategic Thinking Group as well. The Deputy Secretary and ODP writ large has been very forthcoming with what they expected. They've solicited information, but until we get the concrete percentages, right, outside of the proposed, we're not going to really be able to articulate whether we think that there's going to be in a timeline. And I will add that you've got some high-performing providers here. I'm very familiar with both Judy and Linda's programs. I'm not worried about them. I'm worried about maybe some of the smaller organizations and whether they're going to have the cash outlays to perform at a measure that they're being expected.
Thank you.
Thank you. Chairman Heffley.
And we have 13 minutes.
I'm going to take 7 of them, so you can take 6.
And I guess this would be across the board to all the providers. Now, I believe each one of your organizations has been somewhat involved on one of the panels or committees, and you're getting information from ODP. This is a huge undertaking as to what their expectations are for these matrices. But what about the providers that haven't been on a panel? Are they getting that information as well? How are you getting that information out to them? Because so that they are also, because if this is implemented January 1, they're also going to have to be fully up to speed on what those expectations are. So it's a 2-part question. The other part is the matrix of what the standards are going to be. We're talking about people that in a residential. This is their home, right? I can go into somebody's home and I can look at their kitchen table, and I go into my home and I look at my kitchen table, and there's 2 different standards, right? So this is still their home. So, and how people feel comfortable in living. I love to hang my sports coat on the back of the chair in the kitchen. My wife despises that, so I don't do it anymore. So what, but this is still, how do you make them feel, these individuals feel comfortable in their home? And is this matrix going to be, provide some flexibility? And maybe somebody just doesn't like to fold their laundry when maybe they just like they don't like to make their bed anymore. They make the bed, but is there going to be some flexibility that we're not going to see some of these standards not being able to be met? I guess there's a two-part question.
And if we can just have maybe one response on because of lack of time.
I'll take, I think the first question, Chairman, was how are people getting the information?
That weren't
right?
involved in.
That weren't involved. So I'll take a stab at it and say that we have obviously, as you said, been on committees, but our statewide providers, ODP themselves obviously have been sending information, although there's been a lapse of, after the framework came out, we've been waiting for some more information. But as our statewide providers, provider organizations are very, very involved. And so I know that those that are involved, who are members of the statewide provider organizations are receiving as much information as we can get through their connection and their obviously communication with the department, as well as keeping us engaged and then us working together. One of the things that I think is extremely important is that we as providers have the opportunity to learn from each other, that we have the chance to be able to connect with one another, figure out what are people doing. I know that the question that was asked before, I believe that we have needed to begin to prepare prior to. So you're using as much information as you can to start to see yourself how you're going to get to these standards, although you're hoping that your quality is already existing, and then how are you going to be able to get to the next level tier. But as far as information sharing is concerned, we are relying on our local and state provider organizations to support us, as well as the department to be able to share what they have in part. Right now, we need more because of the fact that we need the detail.
I can tell you, as the immediate past chair of RCPA, this has been the top subject since 2023, and in all of our board meetings and in everything we send out. In addition to that, the deputy secretary participates in the PACA meetings, which are the county commissioners' subcommittees, and that information, the same information, is disseminated to the AEs, the administrative entities, for them to be able to pass things along. We also have special SEO meetings with PACA. Some of them are embedded in county, some of them aren't, and so I think the information has been pretty widely disseminated.
So if I may, I was going to say perhaps GN and I can split the piece on flexibility.
You can do that, but I only gave the chairman 6 minutes, right?
I think we have 2 left.
Actually one, Linda, just one.
Okay. All right, real quick. So with regard to flexibilities and making sure that as we move into, preparation for the transition to performance-based contracting, making sure that it does not become the focus or take away from the services that we deliver. I believe that we will be working harder to elevate what we already provide, and that person-centered planning being the core foundation of everything that we do. We will still be mindful, very respectful of every individual that we're privileged to support. And if that person doesn't want to hang their coat on the back of that chair or wherever they want it to lay, it's their choice. It's been very clear to us, the foundations of everyday lives, nothing changes, it's just enhanced even more. And so with that, what we're doing is, I believe, adding the next layer, which is that integrated and coordinated health that maybe is present, but is not at the level that we need it to be.
The only thing I would add is that, and the deputy secretary can shake or nod her head, I see her in the corner, that one of the good parts about this is, regardless of what tier the provider falls in, the person that's living in the home at the time is going to stay in that home. So there's going to be very little sort of volatility in that regard. I mean, so that's one of the benefits of the system as it's being proposed.
Okay, Mr. Chairman. That was 8 minutes. Representative Williams, if you could be very quick with your question and
Thank you, Chairman. I will be quick because it felt to me like you just got honest. For a moment, I was feeling this sort of tension between some proverbial pink elephant in the room where you are being safe and unfortunately way too complimentary. It seems like we're just getting now to where the cat is scratching. And I appreciate the conversation around details and communication, but I could feel that you weren't being completely, at least in my view, transparent around where the issues might be. In the words of my grandfather, I like to get the hay down where the goat can get it. And so I wanted to be able to hear more clearly an articulation of where you think the trouble spots might be. I think we're moving in that direction now. So I'm fine. Thank you, Mr. Chairman.
thank you, Representative Williams. And I need to find out where you're from, man, because those sayings, the goat and stuff like that, I need to bring that to Philadelphia, so thank you. I'm not going to ask questions, but I'm going to make some comments based on some of the information that the testifiers shared. And these are somewhat part of a concern as well. As we talked about this rollout, Representative Struzzi questioned about the time frame and the comfortability of it. And I appreciate Representative Williams talking about the honesty because, you know, we need to hear some of the concerns that the providers are having because we're all in this together. You know, we work in respect and conjunction with the administration, but by the same token, we have an obligation to serve folks all across the Commonwealth as well, and U.S. constituents to someone, whether they're on this committee or not, but someone in these august chambers. It's important that we work with you, hear from you, so that way we can work closely or even more closer with the administration to make sure that this rollout is favorable towards and providing outcomes that those folks out that you provide services to need. As we talk about smaller providers, I'm sorry, Mr. Doltz, I'm sorry, Mr.
James.
Yeah, James. I'm looking all around like you messed up my order when y'all sat down, but that's okay. Mr. James, how long has your organization been in business?
Since 1974.
74, okay. And is it safe to say that all of you are pretty much of the same size in regards to service? I'm familiar with Spin, who was a former employer of mine, Horizon House, who was a long-term employer of mine, so I didn't really want to ask them questions because then I'll come back and penalize them.
We're taking applications, Chairman.
Oh, I'll keep that in mind. I'll keep that in mind. But are you all of this pretty much of the same size?
I would say
In regards to providing services?
We're smaller than Spin. We're about $32 million in annual revenue. So we're probably about a third of Spin.
Okay, and the area, you guys are you're pretty large.
SEOs are not as large as residential providers.
Okay. So, and Spin and Horizon House are somewhat of the same size.
I think bigger in IDA.
Okay.
Yeah,
And
but
the reason I
we're-
asked that question because there was some comments talking about the size of the agency, and as we're seeing in other industries related to DHS, with value-based performance in another arena, we don't want to see smaller agencies penalized simply because of the size. I mean, if we're talking about service, we focus on service. We're not focusing on size. And no matter what size you are, the bottom line is that you're all providing a service to those folks who truly need them. So we want to make sure that there's no penalty in that particular case. And then the other part, and I think, Ms. Dolzman, you brought it up as you talked about the administrative burden. You know, some of us have been involved in politics for quite some time, and it seems though sometimes when there's a rollout of services or new implementation of programs, sometimes there seems to be an administrative burden as opposed to focus on the service in and of itself. There's additional paperwork, and you're penalized for not necessarily getting those paperworks in a timely fashion. So glad to hear that some of you have worked on the committee with the administration for this rollout. But again, it's important that we hear from you in regards to any quirks or concerns that you have, so that way we can also be an advocate for you, along with you, as it relates to working with the administration and rolling this new initiative out. With that being said, I know that the members have at least 1 minute to get to the floor. If you walk slow, I'll give you a note stating that you were here. Again, want to thank the testifiers and the administration for coming. This is a very important rollout that will be taking place this January, and we look forward to working with you and addressing any concerns you have. Again, thank you for being here. This meeting is now adjourned. Thank you very much.